Welcome to Your Family's Health, the program that focuses on healthcare issues with unique and different modalities for taking charge of your health today. Experts talk weekly with our continuing roster of guests from around the country and right here in Nassau County to keep you up to date on the latest health issues and trends. Take care of your mind, body, and soul. Spend the next half hour with the voice of Nassau Community College, 90.3 WHPC, and get on the journey to better health.
Hello and welcome to Your Family's Health. My name is Dr. Janine Cookerard from the nursing department here at Nassau Community College. Today we're going to talk about children and their sleep habits. Why is sleep so important, especially for our kids? My guest today is Dr. Blaine Leeds, a provider who helps people smile and sleep. Dr. Leeds is a practicing general dentist for 28 years, licensed in 12 states, and a provider of clear aligner teeth straightening. He is also an expert in sleep health and has co-authored the book, What Happens When Your Child Doesn't Sleep? Unlock the Secret to Happy, Healthy Children. And he will tell us about the connection to our dental health and our sleep health. Dr. Leeds, welcome to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. Welcome, welcome.
Thank you so much for having me, Dr. Janine. Excited to talk to you guys today.
What made you decide to go into dentistry and now sleep health?
Dentistry kind of chose me. It was very strange. I was always planned on going to medical school. I wanted to be a pediatrician, loved kids, loved teenage kids, high school kids, coached kids growing up in youth sports. And so really enjoyed being around young people. And so thought that's what I wanted to do. And I was serving as the student body president of the little land grant institution where I was going to college. Shout out Arkansas Tech University in Russellville, Arkansas, Fight On, Arkansas Tech. So anyway, I was serving as the president of the student body, and in walked Dr. Fantastic Phil Dowdle, who was the longtime admissions director for the University of Tennessee Dental School. And he found out I was a chemistry major, and he started saying, "Why aren't you going to dental school? You should go to dental school." And so because of Phil, I looked into it, and a few months later, I was accepted and went on to dental school and didn't know anything about it. A lot of people that go to dental school, their parents are dentists or their uncle's an orthodontist or something like that, or they were, an orthodontic patient growing up, so they had a crush on their orthodontist or whatever it was. But I didn't know anything really about the materials or the science behind dentistry. I just knew that I wanted to help people, and I like to be around people, and I thought about med school, so why not dentistry? And so it was very eye-opening for me. I didn't know a lot about the goops and pastes and putties, which we no longer use anymore, but got into dental school, and then practiced at a very standard, general dental practice in a small college town in the South. Had probably 4,000 patients or so that thought that I was their dentist. Only about 1,500 people who were really active and coming in twice a year for hygiene and all that kind of stuff. But I became a sleep apnea patient myself, and that's what got me interested in sleep health because I learned so much more about it because I was a patient. And so I started kind of retooling my practice to treat the whole patient instead of just their teeth and tongues and gums and, their oral cavity. And we started, taking blood pressure on every one of our hygiene patients just as a nice service, because we know that elevated blood pressure, unexpected elevated blood pressure, is a sign of sleep apnea, which I had begun having. And so that's what got me interested as I became a patient myself. And then we found out that, we can expand patients and help them breathe better and create more space in their skull and their nasal cavity for them to breathe properly. And then we can certainly do that with children. All children are still growing and developing, between the ages of 2 and 9, which is the ideal time to kind of catch this stuff and get out ahead of time and treat it. And so, knowing that we can expand all these kiddos with a simple appliance, if they're compliant enough to wear it, that's removable. I was just fascinated by that, and spent the last 7 years or so working exclusively in the clear aligner, Invisalign style teeth straightening world, which, by the way, there's lots of advances that are being made there as well. So that very soon, we're going to see appliances that are hybrid expansion appliances and clear aligner devices, so that patients are not only straightening their teeth, but they're expanding their palate and their mandible correspondingly, and they're going to have a better nasal breathing path in their airway. So that's kind of my path to 2024 and the journey that got me here.
So what is the connection between sleep and teeth?
Well, the connection is, your jaws are the lower part of your skull. And when our jaws are underdeveloped and too small, which we know now that we're about 4 generations into these patients who, probably didn't breastfeed very long, ate a very soft diet as a small child, 2 things that we now know contribute to underdeveloped jaws. And we have, when we were kids, you seem much younger than I, but we'll call ourselves contemporaries for the show today. But when I was a kid, maybe one kid on the block had braces, and then by the time I got to dental school, half the kids had braces. And now it seems like 75% of our 12-year-olds are going to have braces at some point, or clear aligners in high school. And so why is that? Why do people need braces? Why are their lower teeth crowding? Why do all adults seem to have crowding again if they lose their retainer or they don't wear their retainer? An orthodontist will tell everybody, retention appliances are for life. You have to wear your retainer forever or your lower incisors will move. Well, now we know that if our jaws are the right size and we expand the jaws to the proper distance across the mandible or across the palate, that all the teeth come in because there's a foundation for all of the teeth. Many of our patients that have expansion to the right distance parameters in their oral cavity don't have to have their wisdom teeth removed. They don't have to have bicuspids removed for orthodontics. And so, if a dentist says to your 11-year-old this week, if you're listening to the show, and they say, we probably should just take out some teeth, that really doesn't have to be done in 2024 and beyond, except in extremely rare cases. And so many times that's just done for speed and efficiency because they're going to have more space than they need when they finish. And, we wouldn't lop off someone's pinky toe to make it fit in their stiletto heel pumps. We don't do that. We need to make the jaws the right size so they could receive the teeth. But that's what we're up against. When we have underdeveloped jaws, then patients cannot breathe properly through their nose because their palate, if their jaws are too narrow, the palate becomes arched. And the palate is the roof of the mouth, right? But it's the floor of the airway space. So inside our skull, we don't have the right distance and space in there and room to breathe properly through our nose. So nasal breathing is the key. Human beings are supposed to be breathing 100% of the time, effortlessly and visibly, quietly through their nose. And when this happens, it triggers a little sensor back in the oropharynx near the parasinuses that cause the body to secrete nitric oxide. And nitric oxide is a potent vasodilator, which means the vasculature expands and oxygen-rich blood gets to the brain, the heart, the developing muscles. So in a child, it helps them grow better, thrive better. Their sleep is restorative. And that's what we're missing a lot of times today with our kiddos that have underdeveloped jaws.
So how prevalent is this with children with underdeveloped jaws and or the palate? Do you see that a lot in your practice?
The one-word answer is very.
Very.
What we see, my colleague and partner who's not far from you guys, Dr. Ben Moralia, has a practice there in Mount Kisco, New York. So just across the water from you guys there where you're taping today, or north a little bit. I guess you go to Poughkeepsie and go a little further northeast to get to where his practice is. But he's been doing this for 20 years. And if we look at, and we have a group that we're treating these children online all across the country, and we just crossed the 1,000 patient barrier. We've treated 1,000 patients now. They're in treatment with an online process for this. But if I look at 1,000 patients, there might be one who can't benefit from treatment of some kind. In other words, it's a very small percentage of children who aren't somewhat crowded in their development, because kids now, they leave the incubator, with a pacifier. Mm-hmm. So, they've got that device where they're moving their cheek muscles inward, and it's just the developing palate is just inching its way up because the molars are moving closer together. So it is extremely prevalent.
So tell me, is this something that you see the children will outgrow? Will their palate expand with age? Or is this something that once the palate you see is underdeveloped, it will continue to be underdeveloped throughout the child's adolescence? Yeah,
it's the latter of the two things that you said. And there are still medical folk out there who, I was at the American Academy of Dental Sleep Medicine meeting in May of last year in Philadelphia, and there were some medical folks there. There were researchers who were quoting studies of 7 children. I treated 7 children this morning, right? So the study they had used was only 7 kids, but they were questioning whether sleep apnea really existed in kids and sleep disordered breathing. And I can tell you from our clinical experience, we see it every single day, and it's just getting more and more prevalent throughout our kids because of the years and years of, because you've got now the anatomic component. Mom and dad had similar genetics because they too, were fed a soft diet and had an arched palate, and so there's a genetic component there too. But the answer is no. In most cases, it's a very rare case where a child actually starts to expand their own palate or grow in a certain way. The body's expansion appliance is the tongue. Mm-hmm. And if the tongue is in the right place, which now we know that even with just myofunctional therapy from a hygienist who's gone to extra training to understand myofunctional therapy, that's a very good way to treat this. If someone's listening and they feel like their child has issues, before they get an appliance or anything, or even see a dentist, there are online places where they can talk with a registered dental hygienist who's done extra training in myofunctional therapy so that the child can learn where to place the tongue, mm-hmm. because the tongue is supposed to be up in the palate. And that's what causes the sleep apnea issue, is when the jaws are too small, the tongue can't fit broadly across the palate with the tip of the tongue behind the incisor teeth. Right. And so when that doesn't happen, then you have a narrow palate, the tongue falls back in the airway, and you have obstructed breathing.
So with the sleep apnea, you're talking about primarily children that you're addressing now, or is this across the lifespan?
Oh no! If it's not corrected, then we'll see it all the way into adulthood.
But you treat the age group of children, or you do pediatrics, or you do across the lifespan? Across the whole lifespan.
Okay. Right? I treat kids. And
as well as adults.
Company treats children exclusively, but also, we in our practice we'll see adult patients as well.
So when it comes down to sleep apnea, I know that you talk about the thickened neck and possibly a deviated septum and possibly other kinds of a connection to obesity. Are those predisposing factors, or would you say the ones that you have just mentioned were more prevalent in sleep apnea?
The ones I've just mentioned. In fact, it's a common misconception that obesity is a problem with sleep apnea. It certainly contributes, and as somebody who needs to lose a few pounds myself, I'm in that camp. I need to. But and there is one study I think that showed that if people lost 17 pounds. Many times their sleep apnea or their sleep obstructed breathing would go away. And so, there's something to that for sure. But the answer is I see tall, skinny people who have apnea, and it's mostly based on their ability to breathe through their nose. And I've even seen patients, when you look at a deviated septum on a CBCT, you could, if you think about that, if my fist is the palate, for people that are watching this on YouTube or whatever, you can see that if we flatten the palate out, I've seen nasal septum correction by expanding the palate, because it's really just crunched because the palate's elevated. And so it's really about how well does a patient breathe through their nose? And if we can help with that, then, what we're trying to do with our adults is many of these patients cannot tolerate CPAP, which is the gold standard treatment, for sleep apnea. I'm trying to wean myself off of my CPAP now. I'm one of the lucky ones, the 4 in 10 patients who thrive on a CPAP. I put mine on the first night. It took me 20 seconds to put it on, not any longer it takes to put on a baseball cap. I was asleep in less than a minute, mm-hmm. and I slept 4.5 hours. It felt like I'd been asleep for a month.
Yeah.
And so I've had a good experience with CPAP, which has really kept me from treating myself with all the, the appliances and things that I have access to. I'm working through that, but it's not really a priority to me as much because I sleep so well with my CPAP. But we know with CPAP, we're just treating signs and symptoms of the root cause problem, which is inability to breathe through the nose due to restricted palate and restricted airway.
You're listening to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. My name is Dr. Janine Cook-Garrard, and today we're learning about connection between our teeth and our overall sleep health. My guest today is Dr. Blaine Leeds, a practicing general dentist and an expert in sleep health, and has co-authored the book, What Happens When Your Child Doesn't Sleep? Unlock the Secret to Happy, Healthy Children. So I understand that you against so-called medicines like ZQuil and other melatonins. You say that they're not good for the child. Tell me about your perspective.
Well, did I say that? I mean, because we use those from time to time. Is that in the first chapter of the book that we sent?
Yeah, ZQuil. Do you prescribe ZQuil, or do you recommend it?
I don't, but I don't have a problem if that,
Okay.
A patient, if that helps somebody, or there's some melatonin, that a child is taking, as long as it's dose appropriate for their size.
Okay.
I mean, melatonin is just our sleep hormone. If it helps them sleep deeper, then I'm okay with that. But I want to rule out first that they don't have some sort of a sleep disorder breathing issue, because we don't want to just make someone sleepier rather than, again, we're treating a symptom, which is the insomnia, not the breathing. So, but I'm okay with some of that, depending on the patient.
So how does one, or how do you or expand the palate? What is some of the therapy you do for this anatomical, treatment in children? I would imagine this is only for children. Am I right?
Yeah, in children.
Yeah.
We can expand adults too with clear aligner orthodontics.
Okay.
We can actually get distance between the molars. There are multiple companies out there like OrthoFX and Candid Orthodontics. There's 74 companies now that make clear aligners.
I'm familiar with Bite.
Yes.
Yep.
I'm very familiar with Bite. Sure am. And they do a good job too, and they're completely remote. So, if you want to just order impressions, or you want to have a scan and send it off to Bite, you can do all of that, through the mail, get your aligner shipped to you. And you won't get the expansion with clear aligners that you'll get with a surgery or an appliance in an adult. And that's why our focus is on children primarily, because we know we can expand children. And your question was, how do we do that? Well, the tongue is the natural expander. And so we have an appliance. The appliance I like is called Tooth Pillow. It's actually made by a company called Vivos. Vivos is out in Denver, Colorado. And they make a series of guides. And we call the smaller version of these guides, we call Tooth Pillow. And you can learn about that company at toothpillow.com. Full disclosure, I'm an advisor for that company. There's 4 or 5 companies that do it. Healthy Start makes an appliance. MyoBrace makes an appliance that I will use sometimes. But these are flexible devices they have just the right amount of flexibility and rigidity so that chewing into them doesn't tear them up. But they last 6 to 9 months, and we graduate a child up as they grow into the next size stock appliance. And basically it serves a purpose of keeping the muscles of the face off the dental alveolus. So when a child is sucking on a pacifier or nursing, that they're not, we're combating that. In other words, when they're breathing and at night. And also it's allowing room for the tongue. So and there's a training device in the appliance where the child can hit it with the tip of their tongue, and helps them place their tongue in the right spot. Because basically what we're trying to do is create room for the tongue to get in there and do its job, which is to keep the palate expanded to the right width.
How would a parent notice if the child is experiencing sleep apnea? What are some of the signs that, if I were a parent and I was looking at my children, observing their sleep pattern, how would I know?
A common one that's a visual sign is venous pooling. In other words, the child has dark circles under their eyes, or they just look tired. Or are they tired? Do they seem irritable? Is it hard to wake them up in the morning when it's time to get up and get ready for school? Do they drool a lot? Children that are having difficulty breathing through their nose will choose breathing through their mouth over swallowing all their saliva. And so many times they'll be drooling more than is normal. Sometimes just a note from the counselor at school. Maybe they've been way too talkative, or they don't have a good attention span in class. They've been maybe they're having discipline issues. All of these are signs that they could be having difficulty breathing and difficulty sleeping.
So when they go into their primary provider, what might be some clinical signs that the provider will pick up that will say this patient has been or is experiencing sleep apnea? Is there any clinical signs or laboratory findings that we can look at to diagnose?
Well, typically it's most of the time the signs are picked up, frankly, by someone outside the medical profession, and things are recommended, for the patients to look into. But the medical community, sadly, and the dental community, most of my education about this came to me through graduate CE training, and a lot of the medical providers will, they will treat signs and symptoms, but not understand that there is a correlation with the oral cavity and the size of their jaws. But they will notice things like the child is mouth breathing all the time. Mm-hmm. Sometimes allergy symptoms can be a clue, because if a child is having difficulty breathing through their nose, it will many times surface as an allergy problem, or they're always having congestion, which is really not the case. They're just breathing through their mouth. And when we breathe through our mouth almost all the time, the nasal passages tend to close off more often. Mm-hmm. Tonsillitis, adenoid problems with these children can be signs and symptoms that they're having a sleep issue or a mouth breathing issue.
So how much sleep should a child be getting?
Well, it depends on their age, but always 8 hours. Even every adult, should be getting at least 8 hours a night. Many of us don't do that, myself included. But I would say 8 to 10 hours, depending on their age.
So how about children diagnosed with ADHD? What is the connection in terms of sleep habits and their poor sleeping habits, if you will?
Sure. Well, we see a lot of common similarities in signs and symptoms. And in other words, irritability, difficulty paying attention, falling asleep in class, disrupting class, inability to sit and focus for long periods of time. All of these are signs and symptoms of sleep deprivation, as well as attention deficit and hyperactivity disorder. And so, if my school counselor, met me in the school pickup line today with my 6-year-old and said, "Hey, Tommy's having some trouble in class. We'd like for him to get evaluated for some attention issues." The first thing I want to do as a parent is I want to make sure that my child is breathing okay and that they're sleeping okay, because there are certainly kids who need medical, pharmaceuticals for what they're dealing with. There's no question about that. But what we're saying is let's rule out what the root cause of those issues might be. Let's make sure they're sleeping and they're getting restorative sleep, and they have every chance they can to perform well at school and in other functions throughout their day. Let's make sure they're breathing all right.
So if a patient comes to you and they have possibly a couple of dental implants, can you still treat them with the Invisaligners or those bite, those different types of aligners that would help their palate and their teeth alignment? Sure,
you can do that, but the implants are not going to move because the bone is actually grown to a mineral coating on a titanium implant, whereas the tooth has a periodontal ligament that surrounds each tooth between the tooth and the bone. So, and really what you're moving in orthodontics is you're moving the bone around the implant. But we'd need to have some oral surgeons and some implantologists on here to talk about the possibility of actually moving a ridge height of bone with a removable aligner appliance. But typically when we plan them, if a patient has an implant, we plan on making the case as aesthetic as we can without moving that tooth.
So getting back to your career as a dentist, I understand you do a lot of work using virtual telehealth methods. Talk to me about dentistry over Zoom.
Well, there's several different ways that we can actually treat patients now in 2015 and beyond with telehealth. In 2014, I knew that once I saw FaceTime on a phone, on my Apple iPhone 4 back then, probably, or something, 5, what generation was it? I knew that somebody was not going to want to take the train in to Manhattan, from out on Long Island, to have an appointment with their root canal specialist to find out, okay, I'm going to have to come back 6 weeks from now, and I'm going to get antibiotics, I'm going to come back and get my treatment. And so we knew that some sort of exam or counseling could be done this way, but also, if we use what we call store and forward technology in the orthodontic world, where we gather records on a patient, and maybe it's through a dental office, or maybe it's through a remote imaging center where we get just some images made of their mouth, and we're able to look at that and prescribe clear aligner treatment via telehealth by looking at the patient's data. And it's very thorough exam data and high definition photographs, and also an orthodontic scan, which is just a bunch of pictures that are taken simultaneously, almost 6,000 images a second, that generates a three-dimensional image so that we can make clear aligners based on that and treatment plan for the patient, a series of aligners. And it turns out that these short-term cases, 3 to 6 months of treatment, we can do that with a lot of accuracy via telehealth and ship aligners out to patients like they do at Byte and other companies, and help a patient out via telehealth. We can also, with the children, we don't even have to have a scan. As long as we just have a survey from parents, we're checking off all the boxes on the symptoms. And if I see a photo, and actually I could share with you in about 10 minutes, and you could diagnose kids sitting across the airline terminal from you. You could, once you see the signs and symptoms of this, you can't unsee it, really. And so for kids in telehealth, all we really need is a survey and some photographs. We don't really even have to have a one-on-one physical interaction like you and I are having now. As long as I can see their photos and I can see what mom and dad's concerns are in a survey, a detailed survey of their sleep habits and some of their breathing habits that I can see, then we're able to treat them.
Awesome. So how do we find out more information about you and contact you if you wanted to?
You can go to drblaineleeds.com. The site for the book, Ask Dr. Leeds, Ask Dr. Leeds, no dashes, dots, or periods.com.
Well, there's so much to know about teeth and sleep. Thank you so much for being here, Dr. Blaine Leeds, a practicing general dentist and an expert in sleep health, has co-authored the book, What Happens When Your Child Doesn't Sleep? Unlock the Secret to Happy, Healthy Children. Thank you so much for giving us this very important information, and we hope you continue to stay healthy and keep doing the great work that you're doing.
It's my pleasure. Thank you so much, Dr. Janine, and everybody have a healthy, happy week out there in Nassau County. Great talking to you.
This is Dr. Janine Cook-Garrard from the nursing department here at Nassau Community College, and we want to thank you for listening to this week's edition of Your Family's Health.
We'd like to get your feedback on your family's health. Send your comments by emailing them to whpc@ncc.edu. Podcasts of today's show are available on iTunes, Android Podcasts, and Spreaker. This program was produced at the studios of Nassau Community College in cooperation with the nursing department. Join us next week for another edition of Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.